welcome to a very exciting session 3, which is entitled Rethinking Child Psychiatry in the Caribbean. We have 2 presenters. The first presentation comes from Dr. Helen Henningham and colleagues, and the topic is Challenging Flogging in the Jamaican Schools, the Irie Toolkit. The team is ably represented by Taja Francis, who is currently pursuing a PhD in epidemiology. She's a junior research fellow at the Caribbean Institute of Health Research, and she's a member of the Irie Classroom Toolbox team, which is a teacher training program aimed at providing teachers with behavior management strategies to create an emotional, supportive classroom environment. Taja has extensive working experience with basic school children and teachers, and she was just telling me that she has been part of this team even before the Irie Classroom Toolbox actually came into existence. So lots of experience. She has seen this project evolve, and we look forward to hearing what she has to tell us.
Afternoon, I'm Taja, so I'll be presenting. Thank you. Right, so I'm presenting in space of Dr. Helen Henningham. She can't be here with us today. So I'm presenting on the Irie Classroom Toolbox, a cluster randomized trial of a universal violence prevention program in Jamaican preschools. The aims of the Irie Classroom Toolbox are to prevent violence against children by teachers, to reduce aggression among children, to promote children's social and emotional competence, and to prevent the development of serious antisocial behavior in children. Now, the aims of our toolbox are well aligned with global policies like the United Nations Convention of the Rights of the Child, which says children have a fundamental right from all forms of physical or mental violence, and it's also well aligned with goals 4.2 and 3 of the SDGs. Now, before the development of the Irie Classroom Toolbox, we did lots of prior work in basic schools. So first, we did some preliminary work where we had focus groups with teachers and parents, talking to them about their needs, different behavioral difficulties that they observe with children in schools and so forth. And we also did some unstructured and structured observations of basic school classrooms. So we wanted to find out what the day in a basic school is like from start to finish, what happens, the schedule, things that happen, and so forth. And then we did some minor adaptations to an evidence-based intervention, which is the Incredible Years. And then we did a pilot study in 5 basic schools with 27 classrooms, and we delivered the intervention to those 27 classrooms, did some quantitative and qualitative evaluation, and after doing that, we made even more adaptations to the Incredible Year so that it could better fit our context in Jamaica. And then we ran an efficacy trial in 24 basic schools and gave the intervention to 12 of those schools, and then again did quantitative and qualitative evaluation in a cluster randomized trial. Now, the Irie Classroom Toolbox is specifically designed for use in low and middle income countries with teachers that have limited formal training. It's ideal for where schools that have low levels of human and physical resources, so where the student to teacher ratio is large, where you have insufficient teaching and learning materials, where the school may have poor structural conditions, overcrowded, being noisy, and there's low investment in education, and where you may have teachers that have low self-efficacy, they have burnout, and they are very stressed and have low pay. So we developed the toolbox specifically for teachers going through these circumstances, one or even all of these factors. The toolbox was developed based on an idea of evidence-based kernels and behavioral vaccines. Now, an evidence-based kernel is an irreducible unit of behavior change technology, and you put the kernels together to make behavioral vaccines, which result in daily practices that will over time result in behavior change. Now, when we're developing the toolbox, so we use the results from the efficacy trial to tailor it for dissemination. So we found out from the qualitative interviews and the quantitative evaluation, we found out what strategies were the teachers found easy to use, what was most effective, most relevant, and which ones they used the most. And then in terms of implementation, we looked at the training methods that were most effective and which ones the teachers liked best. And we filled in the different gaps that we saw after when we were doing the preliminary work. So we wanted to make sure that we improved the training methods for the key principles that we wanted to bring across to the teachers. And from spending time in the classrooms, we realized that there were some issues with instructional, with teaching. So we implemented that instructional strand into the toolbox as well to improve the quality of the instructional support in the classrooms. And so because we wanted it to go bigger, we decided so initially we had lots and lots of strategies in the toolbox, in the program. So we reviewed it and decided to cut it down to say which one of these strategies are the best ones that will result in change and will be beneficial to the teachers. So we simplified it and we manualized it, so we have manuals that we can give to, because we want to train multiple persons to deliver the intervention, so we created manuals and we made it more flexible so it will be easier to disseminate and to scale up. Now it's called the Irie Classroom Toolbox, so that's a toolbox. So you have in a toolbox, you have tools. So our tools are the different strategies that we give the teachers, such as giving children choices, teaching children rules, giving children responsibilities, making learning fun. So just as a toolbox, where if you have a problem, you take out a specific tool to fix that problem, these teachers have a toolbox filled with lots of strategies or tools. So when problems arise in their classrooms, they pick out whichever tool they need and use it to address that problem. So this is just a visual representation of what the toolbox looks like. Now, the content of the toolbox, we have 4 modules. The first module is creating an emotionally supportive classroom environment, and it includes things like building positive relationships, praise and rewards, and an interactive read-it component. Second module is on managing child behavior, So we have strategies to prevent behavior problems, strategies to manage misbehavior when they do arise, and games to help promote children's executive function. The third module is promoting social and emotional competence, where we teach children friendship skills, teaching them how to understand their emotions and how to problem solve. So we have some problem solving stories. And the last component is behavior planning, where we guide teachers on how to do an individual behavior plan for specific children in the classroom, as well as class-wide behavior plan if they're having a class-wide problem. This is some example of the intervention materials that we give to the teachers. So each teacher is given a puppet. And then we have the Irie Classroom Tools, which is the actual manual that we give the teachers. So that manual has all the strategies that we'll cover and gives them guidelines on how to use those strategies. And it's complemented with an activities book that has lesson plans, like how to teach rules, how to teach friendship skills, and games and songs. We also give them some problem-solving stories. We give them emotion cue cards, friendship cue cards, and rules cue cards. This is an excerpt from one of our problem-solving stories called The Special Book. Now, the problem-solving stories, it's a picture book, so there are no words, but we have a little note at the front that instructs the teachers on questions she can ask, how to bring across the point of the stories. And all of the problem-solving stories, they depict common classroom problems that children face in their everyday life in school. So teachers handing out a book, you want that book, you can't get it, what can you do? And it shows that. Now, this is an excerpt from the Tools book, which is the manual for the teacher. And in the Tools book, each page is a strategy. And it tells, so this is from the Building a Positive Relationship module. And one strategy to help build a positive relationship with children is giving children responsibilities. So each page it gives you the strategy, tells you what the strategy is, gives you examples of how to use the strategy, And then it also explains why that strategy is important. So the teachers will have this book forever, even when we leave them. So if they forget how to use a strategy, they can always refer back to their tools book and get guidance on how to use it. How do we deliver this intervention? So the process. We have 5 training workshops where we introduce the strategies to the teachers to motivate them and give them an opportunity to practice the strategy and get some feedback. Then we have 8 sessions of in-class support where we increase teachers' knowledge of the skills and self-efficacy, and we help them to problem solve in their context, using the strategies in their actual classrooms. And then we sent them fortnightly text messages to remind them to use the strategies and to motivate them to continue trying and implementing the strategies in their classrooms. We also give them classroom activities that we call Irie activities that can encourage them to set goals and to reflect on their use of the strategies. This is intervention materials that we, the research team, use. So we have a Irie classroom training manual that the facilitator for the workshop uses. So it has every workshop, it has all the contents of that workshop, questions to ask, activities to do, how to facilitate, what kind of support to give the teachers. And then we have the Irie classroom coaching manual, which is what the coaches carry out when they go to the classroom to actually support the teachers. And then we have DVDs with videos that will play in the workshops to help bring across the strategies. Now, the workshops are one day. Each workshop is a day long, starts about 8:30, finishes 3:30, and it's very full and intensive. We have brainstorming, videotape modeling, discussions, card sorting activities, demonstrations. They do small group work and then come and present, and we give them feedback, problem solving activities, and games and songs. Now, this is an example of a video that we play in our workshop to help bring across the different strategies that we want to show the teachers. So the videos that we show them are very strategic, so it brings across the strategies that we want to show the teachers. So in that clip now, we see that teacher using lots of strategies. So she's following the children's lead through play, which will help to build positive relationships in her classroom. She's giving them lots of positive attention, which will then promote that behavior in the classroom. She's also encouraging friendship skills by comparing children's work. Oh, you made something long just like hers, and that can help facilitate friendship skills. And she's using lots of words that can build language development for the children. So we show these videos, and then we have discussions and ask the teachers questions to help pull out the strategies and the key points that we want. Now for the in-class support, so coaches, they visit the teachers once a month and spend a session with the teacher. And the structure of the session is they go and they do a planning session first, where for about 5 minutes, where they plan with the teacher, introduce, okay, so today we're going to be focusing on this strategy, and the plan how they can incorporate it in the session. And then during the session, the coach actually models, so the coach uses the strategies, and she prompts the teacher to use the strategies as well, and give the teacher lots of positive encouragement when he or she uses the strategies, and most importantly, point out the effect that the strategy has on the children. And after the session, we do a debrief for about 5 to 10 minutes and encourage the teacher to evaluate, okay, so how did this session go? Did you find any difficulties and so forth? And we also encourage the teacher to set goals for when the coach comes back the next month. And we introduce the classroom activities, because we give them little activities to do and return when we come back next time. Now, the coaching manual, the manual that the coach carries out, it has the protocol, so what to cover for that session, what strategy, what activities to do for that session, the planning form that we do the planning on, examples of appropriate goals to set for the teachers, and common problems and solutions. So the strategies some strategies may be difficult for teachers to implement in their context. So there may be some problems that may arise. So they have some problem and solutions. There's a crib sheet to help them when they go out in the classroom, and also the activities. And then a facilitator record form where the coach writes, reflects on how the session went for the coach as well. So you can keep track of the progress that the teacher is making. Now for behavior change, this is a behavior change wheel that we used that we considered when we were designing this intervention. So in order for persons to exhibit a behavior, they have to be able to do it, they have to be motivated, and they have to have the opportunity to do it, to use that behavior. Now for our teachers, the objectives we have for the capabilities, we want them to learn new skills, practice new skills, and we want them to be able to generalize the skill, use it in different situations. So the behavior change techniques that we use to achieve those objectives is the video modeling, the role play, the classroom assignments, and the in-class support with feedback that we give the teachers. Now for motivation, we want them to be confident using the skills. We want them to believe that the skills are useful for the children, and we want them to believe that the skills benefit them. So the techniques that we use to achieve those objectives is to give the teachers lots and lots of positive encouragement and support. We point out the effects the skills have on the children and discuss benefits of the skills to the teachers. Now, opportunities. So we want the skills have to be feasible and relevant to the teacher in their context. And we want the teachers to have the resources in order to carry out these skills. So what we do is that we do problem solving both at the workshop and in the class. So when we're in the class, I will say, okay, say, Auntie, we want you to use this strategy. And she may say, well, I can't use it because X, Y, Z. And then we try to problem solve with her. And the Irie Classroom Toolbox, as I said earlier, was developed just for this context, for our Jamaican classroom context. And we also will give them the resources. So whatever they need in order to use the strategies, we make sure that they have them. Now this is the study design. So we are in 76 basic schools. 38 were randomized to the intervention group, 38 to the control group. Intervention group got the Irie Classroom Toolbox plus educational materials, whereas the control group just got the educational materials. So at baseline, we had 119 teachers in intervention group, 110 in the control group, and we had some losses and some new teachers came, and at post-test in the intervention group, we had 121 teachers, and in the control group at post-test, we had 112 teachers. Now, our primary outcome for the trial was teachers' use of violence. So we measured teachers' use of violence against children over 2 full school days by independent observers that were blind to the study design, hypothesis, and group allocation. And we have 3 categories of teachers' use of violence. First category, physical punishment, which include hitting, shaking, rough pulling, pushing. Verbal abuse, such as name calling, threatening to harm a child, encouraging other children to harm each other, and outright rejection of the child. And then the last category, which is other forms of violence, such as intimidation or nonverbal threats. So on day 1, so we did observe this over 2 days. On day 1, we had event recording was used to continuously record each use of violence across the different categories throughout the school day. So every time the teacher did anything from any of the 3 categories, it was recorded. And then on day 2, observers coded whether each category of violence occurred or not. So yes, she did physical violence. Yes, she did verbal or not during 5 20-minute observation periods. We also had outcome measurements of class-wide child aggression. So we measured frequency, number of children engaged in the aggressive acts, and the severity of the aggressive acts. And we had class-wide child pro-social behavior. We measured frequency, number of children, and the intensity of the interaction. And we also measured the quality of the classroom environment using the classroom assessment scoring system, the pre-K version, and we measured under 4 domains: emotional support, classroom organization, and instructional support. And observers coded all 12 subskills on a 7-point scale over 5 20-minute observation periods over the school day. Now, the class measures the classroom quality. So under emotional support, we have dimensions of positive climate, negative climate, teacher sensitivity, and regard for student perspectives. Under classroom organization, we have behavior management, productivity, instructional learning formats, and in instructional support, we have concept development, quality of feedback, and language modeling. We also measured teachers' well-being and child mental health using teacher-reported SDQ, and we generated difficulties and pro-social score, as well as an impact score. And we also tested the children's inhibitory control using Big Letter Stroop, Silly Sound Stroop, and Frog Bear. Now for the intervention delivery, so we had workshops with 4 facilitators and 4 co-facilitators, and each workshop had around 30 teachers, and we conducted them during during holidays, and the intervention staff received 2 to 3 days of training for each workshop. We had 4 coaches and 1 supervisor, and weekly supervision meetings. Now the intervention was delivered well because they came during their holidays. We had 48% attendance at all 5 workshops, and 91% of teachers attended 3 or more workshops. 91% participated in all 8 of the coaching sessions. Now, for the analysis of the data we collected, it was pre-specified by our funders. We had a trial statistician that was blind to the group allocation and made decisions related to the analysis without seeing the estimated impacts of the intervention. We used multi-level regression analysis were used to control for the clustering of the teachers because of teachers in one school. And all the analysis of teacher and class-wide variables controlled for baseline score, number of children in the class, number of years teaching in the current school, and whether the teachers completed high school or not. And for the analysis of the child outcome variables, we controlled for child age, sex, and number of children in the classroom. Sample characteristics, each classroom had an average of around 16 teachers. Most teachers were teaching at the school for around 16 years. The sample was randomized, so we had around roughly 50% girls, 50% boys in both control and intervention, and children were around 4 to 5 years old. Now, for our primary outcome, which is teachers' use of violence, at baseline, so this is before the intervention, we found that 79% of all the teachers in the study used corporal punishment, 64.4% used verbal abuse, and 88.2% of all teachers used some form of violence against children. Now, after the intervention, so post-test, we found that, intervention teachers used significantly less violence than control teachers with an odds ratio of 0.24. So the odds of an intervention teacher using violence was 76% less than that of a control teacher. Now, benefits, we have significant benefits to most of our outcome variables. So teachers' use of violence, intervention teachers used violence. Okay. We had benefits, lots and lots of benefits. Intervention teachers used way less violence. They had better classroom quality on all domains. Teacher well-being, intervention teachers had better teacher well-being. Children in intervention schools, they were more pro-social. The only thing we didn't have significant benefits on was child class-wide aggression, but everything else, significant benefits. Children that attended intervention schools, they had better inhibitory control. We didn't have any main effects on behavior difficulties. However, for children that were in the clinical range in intervention schools, we had less children being in the clinical range for behavioral difficulties in intervention schools than in control schools. And these behavior difficulties, the impact affected their daily lives less than that of control schools. And these are some quotes from our qualitative interview that the teachers said. They said I like when they use the role play to do whatever we wanted, to teach us, for instance, friendship skills. First, they modeled what they expected us to do, and then they allowed us to role play with puppets and find creative ways to introduce it to the children. They found the in-class support made them feel comfortable and at ease. You know, when you have a visitor or invigilator and you probably get cold feet, everything was just cool. She just come and even pat you on the shoulder, you know, when you pat a child and you feel that comfort. She make you come and make everything just seem easy. And this is on the strategy. Somebody said, my throat used to dry, I'm frustrated, and I used to beat them to stop the noise. That not happen anymore. I don't have to shout at them. You don't have to do that. Once you use any of those strategies, they know what you're talking about, so they just adhere to it. And a teacher said, I have gained self-confidence, and I'm more firm in what I'm doing, controlling the class. Sometimes you get fed up thinking what to do, but now I know what to do. The environment is more easy and less burdened, so it makes you feel good. So in conclusion, we reduce teachers' use of violence against children, improve the quality of the classroom environment across all the class domains, we improve teacher well-being, improved mental health for high-risk children, but we didn't have any main effect, and we improved children's inhibitory control. And the intervention was acceptable because we had a high engagement. The teachers, they attended the workshop even during their holidays. Satisfaction ratings were high from the teachers. And the program is relatively low cost, and it's integrated into an existing system and uses existing staff. So there's potential for scale up, so we can go nationwide. So it's a universal program with population level impact. Thank you.
Thank you, Ms. Francis. I'm sure we all agree that it's a very useful intervention and presentation perfectly timed. Are there any questions for Ms. Francis? Well, while you ponder the questions, I have one, which is, are there refresher courses for the teachers in the intervention?
Well, as of now, no, we don't have. But when we first implemented the program with the intervention teachers, we realized, even after collecting our data, that they needed some more support. So it was supposed to end in the June, but we actually went back in September, October, November to give them some more support. Okay. But as of now, officially, no. Okay. When the ministry takes it to scale, they can do that.
Right. Any other questions? Okay, thank you again. Thank you so much.
Thank you.